शक्ति देना, मुश्किलें पड़े तो हम पर इतना कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जय से पहले खुद को जय करे, हमको मन की शक्ति देना।
Good morning, all. Give tribute to our master Samuel Hahnemann, who made this science for divine purpose and who taught us dare to be wise. Seeking blessings from our Guru, Dr. Prafull Vijayakar, sirs, who bridges this wonderful divine science with the modern science and made homeopathy easy, like mathematics. Jai Hahnemann, Jai Homeopathy, Om Vijayakaraaya Namah. Friends, we are in the journey of completion of the theory of suppression book, and we, as far as we have learned up till this, the aphorism to 16. So today we have the aphorism from the Organon of Medicine 6th edition, 17th aphorism. So we are reading. So aphorism number 17. In aphorism number 16, we have learned that the disease is caused by, most severe disease is caused by the imagination and also be removed by the same means. So this is what Master Hahnemann is telling us, that remove the cause and the disease itself gone. So now, as in the cure effected by the removal of the whole of the perceptible sign and symptoms of the disease, the internal alterations of the vital principle to which disease is due, consequently the whole of the disease, is at the same time removed. If you remove the cause, the internal changes has to be follow, and it also annihilate it by itself. It follows that the physician has only to remove the whole of the symptoms in order at the same time to abrogate and annihilate the internal changes, that is to say, the morbid derangement of the vital force, and consequently the totality of the disease and disease itself. If you remove the cause, consequently the totality of the disease and disease itself has to be removed. But when the disease is annihilated, the only thing is restored is health, and this is the highest and sole aim of the physician who knows the true object of his physician. If the physician know that I have to remove this, then and then he can make it. Otherwise, what happen? Those who consider and learned sound prattling that I have removed the symptom, but disease remain. But what is the physician's sole mission? Is to restored and giving aid to the sick. So this is what Master Hanuman telling us. Now the footnote 10 tell us what? Vijayakar sir has beautifully explained this footnote, that where warning dream, a superstitious fancies, or a solemn prediction that death would occur at certain day or at certain hours has frequently produced all signs of commencing and increasing the disease. A warning dream of approaching death and death itself at the hour announced, which could happen with the simultaneous productions of the inward changes corresponding to the state of externally, and hence in such cases all the morbid signs indicative of approaching death have frequently been dissipated by an identical cause, by some cunning deceptions or persuasion to the belief in contrary, and health suddenly restored, which could not have happened without the removal of the internal and external morbid changes that threaten the death. So this is what very beautifully sir has mentioned that whenever you have some warning dreams, like a dreams of snakes, sir usually tell if you have a dreams of snake, you might end up with the either autoimmune diseases or some syphilitic disorders, or if someone having a dreams of a death or approaching death or dreams of the murder or dreams of the bloodshed. So these all dreams are nothing but the dreams of syphilitic variant. So whenever something is happening at subconscious level, it also happens simultaneously at the level of physical parts and the body. So this is very important aspect of learning. So if you remove that in terms of cause, then you can find that the health is restored. So this is very important. Again, one thing is what are written that is a moral remedy or cunning deceptions by some or persuasion to the belief in contrary. So I will tell you one story about the effect of nocebo effect. There was a person in the either US or in the UK who diagnosed that there was some disease in him, and day by day his health is deteriorating, and he went into emaciation and he was admitted in the hospitals. So all the investigation had been done, but nothing revealed anything out of it. And the process is that he is going to die soon. So this was the syphilitic state of that person's. And suddenly what happened? All the physicians, all the faculty of the physicians has having a meeting, and he diagnosed that person could not diagnose with any of the disease. Why his body is deteriorating to such an extent that he may end up into the state of death. So one fine day, the psychologist came to take a history, and he took the history from the patient, history from the relatives, and everything. So one of the relatives told that there was some persons who came to his house one fine day, and he cursed and he threw something on his face. And after that incident, the person has landed with the disease process. So the psychologist made a story like that. He said that that person is throwing you something in front in your face, and that substance is something nothing but it is the eggs of the lizard, and that lizard went into your body, and that lizard is eating you from inside. So this was the cunning deceptions of the persons, and that person was thinking that it might be the possibility, the diseased person. So doctor advised that we will go for a small surgery on you, and we have to remove that lizard because that lizard is growing in your body and that eating you from inside. So they purposefully made a demo that we are going to have an operation on you, and they put a small cut and make the person anesthesia, and they remove and they put a dead lizard on the table, and they show this to the patient that we have removed this from your abdomen. Actually it is not like that. So the day when he saw that yes, the lizard is gone from my body and the health is gradually restored. So this is what we have to do this. This is a superstitious fancies. So he was in a so much of superstitious belief that create a dreaded disease in this, and that also removed by the imaginations and cunning deception. So this is what a story of a nocebo effect, and this story was I have heard in somewhere in YouTube, and it was also written in one of the book, Biology of Belief, Bruce Lipton. So this is what we have to understand. Whenever there is something is warning dreams, superstitious fancy, or some predictions regarding the death, that has to be removed because it is there in the subconscious, the same way the disease itself is syphilitic is there in the physical body. Now, footnote number 11, it is only thus the God, the preserver of the mankind, could reveal his wisdom and goodness in reference to the cure of the disease to which man is liable here below. by showing to the physician that he had to remove in disease in order to annihilate them and thus re-establish the health. See, why Hanuman has mentioned that it is a divine science? Because when you are evolving yourself, the nature will take care of you and nature will guide you that you have to take this into consideration and to help and annihilate the disease from this patient. So this is what we have to evolve ourselves. But with would we think of his wisdom and goodness if he had shrouded in a mysterious obscurity that which has to be cured in the disease, and shut it up in a hidden interior, and thus render it impossible for man to know the malady accurately, consequently impossible for him to cure it. This is what telling about the allopathic school of medicine. Allopathic school does not understand this supernatural or this is something which is happening inside the body. It is a subconscious phenomena. They just understand the physical one. That's why they cannot cure him. For that, it is nothing. Okay. So this is what the footnote 11 is telling us. Again, we are in the last two chapter of theory of separations. So as far as we have learned up till now, the understanding of the layers from the ectoderm to the genetic code through understanding of the embryology. We also learn that how disease progress and when we prescribe a medicine, how disease regress toward the cure. We also learn to approach the case with the genetic constitutional remedies, and we have seen three, four cases of understanding how to reach to the genetic constitutional simillimum. Now, what we have to do when we reach to the all the phenomenon genetic constitutional semi-minimum and we prescribe. Now, how can we consider that this is the right semi-minimum? Okay, so for that we have to understand that what is the right and what is the wrong. Okay, so there is a chapter in this book is proof of semi-minimum. So, what is the proof of similimum? Whenever you have given a medicine that is a right or wrong, you have to judge by judging the patients. Okay. So, what is the proof of similimum? So, how then to make out whether or not your remedy is a right one? So, there are certain criteria to be followed and examined when the patient came for the follow-up. So first, the proof of correctness and the right prescription is provided by the patient himself after a minimum dose, a minimum stimulus. Following changes could occur. What are the changes has been happening into the body? So first, disappearance of the weakness, if any. So any weakness in the body, it has to be removed. We have, as far as we have learned that whenever the body is working in the homeostasis, so there is the activations of the passive gradient, and in the passive gradients of the activation there is no energy to be used. Okay, whenever the disease has been taking place inside the body, so what happens, the active gradient is acting and thus the disease part uses more energy and make the persons weak. So this is what the disappearance of the weakness is the first sign. Second, normalizing of the stamina and the desire to work. This is a very whenever the every operational things is working in a harmonious way. So the desire to work is the core of the correctness of the remedy. So whenever you are prescribing a medicine and patient says that now I'm feeling better, I need to work or go to my work or I need to do my house chores and everything. For a child, I need to do a learning. So this is what desire to work and normalizing of stamina is suggestive of that your remedy is right. Third, restoral of the original desires and the patience, for example, to read, to play, to eat, study, wander, etc. So whenever there is a desire to do these things and it is restored, when in the disease is there, it is gone away. So this is what you have to understand, that this is the restaurant. So this is the remedies, right? Fourth point, the normalizing of the sleep without dreams. Okay. So this is again the sleep. The patient is go. So why sleep? Because all this is happening because of whenever our body is in a see, our body is controlled by the autonomic nervous system, and in the autonomic nervous system we have a two process. One is called as a sympathetic activity, and one is called as a parasympathetic activity. So whenever the person is in a stressful situations, the his sympathetic activity is going on, and during the sympathetic phase the sleep is disturbed. Okay, but when the person is transferred from the sympathetic to parasympathetic, the resting phase, and the sleep is normalizing. So whenever you are prescribing the medicines, we are converting from patient from sympathetic to parasympathetic. This is what normalizing of the sleep without dream. Again, the physiology is restored, means the normalizing of the appetite and the stool. Third, sixth point, increase in the tolerance to the aggravating factor. Say, for example, the person having sensitive to noise, a slight noise irritate them. So whenever you are prescribing certain medicine, which is the right, so he can tolerate that. Yes, I can tolerate now because previously the my sensitivity is so heightened to such an extent that sensitivity become normalized. So due to that, the noise is irritating me. Now I can tolerate that. Sometimes you find that a person is going into the exposure to sun. So as such, a sun is giving energy to our body, and we are aggravated. So this is what something that the tolerance to the sun has been increasing. Okay, some persons may aggravate it during clouding weather. So now after the remedy, the patient is telling you that this monsoon I could not have my ailment because of now I can tolerate the cloudy weathers. Okay, and most of time whenever the patient comes to you with the certain allergies, so whenever you are prescribing a right remedy, so you need to tell not to stop any allergens. Sometimes what they came to us with the physicians or chest physicians or pulmonologists, they advise that you have a allergy to certain foods and everything. So keep yourself away from that. But you allow the patient take it because we need to increase the tolerance to that aggravating factors. Okay, so this is what whenever you are prescribing the medicines, now patient see I had a case of a person who were having a peanut allergy. So whenever he take the peanuts in any form, he develops some allergy. So I advise eat the same things, not to stop it. And after the prescriptions, the patient says, now I can take a peanuts or in a form. So my allergy has reducing. So that is what the increase the tolerance to the aggravating factor. Very important aspect of understanding. Your remedy is right. Seven, decrease in the sensitivity to rudeness, offenses, or any other exciting emotional factor. So that is what again this 2 point is, one is the physical sensitivity, second is the mental sensitivity. So whenever the person is slightly irritated or slightly affected because of his heightened sensitivity, so that has to be normalized in such a way that person become calm and stable. Okay, the 8 point, tempering of tempers, reductions of the fear and anxiety. So this is again a very important aspect of from syphilitic to psychosis and psychosis to the sora. So that has to be reduced in such a way. So there is very important aspect. Your remedy is right. Okay, disappearance of the symptoms from the higher layer to the lower layer progressively and simultaneously, and appearance of the symptoms in a lower layer of the disease as well as in outward and downward directions. So we all know the theory of suppression. That's why it was example is given. The pain in the heart is better going the pain in the neck first, and then uh, lumbar region next, and then the knee further down to the ankle, heel lastly on the toe, and from toe to cause acidity or diarrhea, and lastly to eruption on the skin. So this is what we have understood the shifting of the fourth layer to the third layer, third to second layer, second to first layer, and this is very important. So disease has to be follow this law. This was the first point we have understood in the proof of correctness of the simile. The second point, the eruptions or a pain on upper part of the body, like a face and neck, should disappear first, followed by on the trunk and then the extremity. So again, in the same layer, if the person is in the same layer, so it follow the above downward rules. This is the right proof of right simile. Third point, the appearance of any new lesions or eruptions or a pain above the level of already existing ones is a bad sign, which would invariably lead to suppressions. So, appearance of the new ones below or on the extremity with disappearance of the lesion already existing is a good sign. So, most of time this question is asked like whenever we have a vitiligo. The facial vitiligo has reducing and the vitiligo develop on the lower extremity. Okay, so you have to be vigilant that it has to be follow the same rules as Heron's law of cure, along with a reversal of miasm also. So in that case, you have to take a notice that it has to be removed soon. If it is lasting longer, that means again you have not checked the syphilitic process. So sometimes your medicine is very nearer to the constitutional remedy and you have to prescribe. So I will share you a case of one of my friend who is treating a case of vitiligo and he had given a lot of medicine. He had given medicine lot of. Then after that, he reached to the similimum, and that similimum was natrum mur. He has prescribed natrum mur, but the patient has reducing to certain extent. Again, it came down. Again, reappearance of the eruption. So he took history 10 times, and every time he land up with the only remedy is natrum mur. So on the basis of all these things, he prescribed and he used lot of different potency also, but all in vain. So finally, he thought that this is the only remedy, but I have to choose some other salt in regard to this. And on the basis of the heightened sensitivity and hot and slightest offend her, so he prescribed natrum iode to the patient. And on the basis of that, all the symptoms has went from above downward within a short span of 4 months. So this is what you have to understand when we take care of this note that many new lesions appearance in the syphilitic form. So you have to be very nearer to the remedy. Okay, this is the clinical and practical tips that we have experienced. A circular lesion should disappear by shrinking of the area of the lesion. It means here the healing should take place from outside in. This lead to the cure. Contrary to the expectations in the local lesion, the singular circular, the cure cannot take place from inside out. That means the center should not heal first, followed by edges. This is sure suppressions, and one can expect a boomerang of the lesion and severe aggravation on the face and scalp or any higher places. These center to periphery types of healing should invariably be associated with the loss of interest in work or reduction in stamina to work or disturbed sleep and bowel movement. So many a time you can see in a ringworm cases, the ringworm is increasing from center to periphery. So this is what not the cure process. It has to be reduced in such a way that from periphery to center. Okay. When the skin eruptions are receding, appearance of the dullness, giddiness, loss of interest in the work, or a sleep reduce and stamina and bad movement, bowel movement, and loss of appetite, or appearance of the joint pain, sneezing, or burning urine is a definite indication of ongoing suppression. So be vigilant that whenever you are prescribing the medicine for the first layer and the patient develop a dullness and lethargy and giddiness and loss of interest and everything, the stamina is reduced. That means you might land up with the patient with the suppression. If the same treatment is continued, one can mathematically expect the bronchitis followed by asthma or diarrhea or UTI. It means an affections of the respiratory GIT or UTI to follow the previous complaint without much delay. So this has happened. Many a time you have seen that the patient came to you with the complaint of ringworm, and the patient was prescribed a medicine, either allopathy or homeopathically, and the ringworm went away. Very difficult to treat ringworm, but ringworm went away, and patient developed uh, hair fall. Patient develop early baldness. Patient develop premature graying of hair. So this is nothing but it is a sure sign of suppressions. Appearance of any deep infections. It means the patient suffering from the acute conjunctivitis, parotiditis, or jaundice, or any infection, diarrhea during the course of treatment is a sure indication that the resistance of the patient which the homeopath aim at building up is not coming up to the mark, especially within. A single dose of the right concentration will take less than 24 hours to strengthen the immunity in endodermal derivated mucous membrane or respiratory tract or GIT tract. So whenever acute infections come, appearance of any deep infections, patients suffering from the acute conjunctivitis, okay, indication that the resistance of the patient which homeopathy aim at building up is not coming. So that means his immunity has not marked. So in that case, you have to prescribe the GCS, and within 24 hours, everything will be all right. Very often we find eczematous eruptions have disappeared from the skin, followed by the suppurations in certain parts with a large uh, red, inflamed, and painful boils being thrown up with the fever. This also is a bad indication since one cannot justify exteriorization of the disease with the reduced immunity and increased susceptibility to streptococcus or staphylococcus infections. So, tendency to the boil after eczema has been reduced. That is also a sign that you might land up with the separations. Okay, because first and foremost thing, the tolerance to the external factor, tolerance to the bacteria virus has to be increased. So it cannot cause again the weaker infections like boils and eczema. So eczema is cured and boils happen. So we are happy that okay, if the boil is happening, but it is a transient form and in a shorter duration it removed by itself, then it is a welcome sign. But it recur again and again with the big suppurations and big boils. So this is what we have lower the immunity and allow the patient to have susceptible to the streptococcal or staphylococcal infection. So that is again a sure sign of suppression. So here our right simulacrum should make the tissue and body part unlivable and unthrivable place for all bacteria and fungi. So hence no need of any antibiotics to get rid of them. So sir always says whenever your medicine is right, no antibiotic, no antifungal is required. Appearance of the gum boil or FT in the mouth during the treatment of the skin lesion is a bad sign. Again, the same thing that the skin lesion is external ectoderm, and again the FT in the mouth is endodermal. So we went from ectoderm to the endoderm. It is bad sign. If the patient does not respond favorably after single stimulations or relapse frequently, or has to be given frequent repetitive dose to make a skin lesion disappear, be sure you are suppressing. This is very important what sir is telling us. If your medicine is right, it will take care within a short span of the time. Okay, so no repetition is required. If higher and higher potency are required, for example, a patient responds favorably to the meserium 30 but relapse often and later meserium 200 or 1 and is given repeatedly to make the symptom disappear, it is called as a frank suppression. Initially, I have treated cases of eczema and the patient is better with repeated doses like 30, 200, 1 m and we are happy, patient also happy. And after 2, 3 years, patient landed with the complaint that you have treated my eczema very well, sir. Now I had a detected thyroid. So what should give me the remedy for thyroid? This is something that you have suppressed from lower layer to the higher layer. So be sure that if your remedy is right, a small dose will take care of everything. This is what Sir proposed, and we had seen that. And in our practice, we had done a lot of mistakes, and from mistake, we have learned something that the only single thing is important. See, I had seen a case of my mentor, Dr. Suketu Shastri, the case of psoriasis, a syphilitic kind of psoriasis, and he prescribed the single dose remedy, and within 1.5 month, whole say psoriasis recovered from head to foot. So, if your medicine is right, you do not require a time, you do not require to repeat. This is what Master Hahnemann is telling us. Disappearance of the symptoms in reverse order of the appearance down the chart of suppression is must, where case is incurable stage of compensation is attained, where in disease symptoms which is less morbid is created in the body and persists for with the general improvement in all other natural habits, tolerance and functioning of the patient. If the above sequence occur with above general and mental improvement in all cases, acute or chronic, then and only then the homeopath is the right prescriber. So this is a took into consideration take home message. This chapter is very important for understanding that whenever we are prescribing any remedy, we have to be judged either going toward this way, either going toward this way. This way is a direction to the cure, this is a direction to the progress of the disease. So we have to be very, very vigilant to understand the follow-up. And this book suggests only about the follow-up. So this is very important aspect of understanding. So the last chapter we are reading today is a different type of separations. Tomorrow we will have a discussions on this book, and a day after tomorrow we will start another book from the source uh, collections of the book. Okay, so different type of separations. All animate things in this world have two degrades. On the other hand, every animate things in this world has to have an innate instinct to survive. It tries all the forces at its disposal to live or survive in this hostile world. One set of the force is always trying to degrade and or shorten the life, while the other set of the force is trying to defend and prolong the life. Man is no exception to this rule. So this is very important. To survive ourselves, we have to defend. So man is apt to face innumerable hostile forces in the world in which he lives and which is ruled by Darwin's law of survival of the fittest. To defend himself, man has his own immune system governed by the animating force, which we call the vital force, which tries to maintain the homeostasis in whatever situations. A dent in this immune system produce what is called as disease. Thus, the disease is nothing but the disturbed homeostasis and failure of the immune system to cope up fully with the disturbing force. The protective defensive force use all their energies to keep disturbing forces at bay. If they are not entirely successful, either due to its own lowered vitality or due to the overwhelming disturbing force, then they may allow the dysfunction to start with the followed by the structural changes of the organs or the tissue or a system which are of the lesser importance, thereby trying to keep more important part as much as healthy as possible. Thus, as our defenses fail, layer by layer or system by system, the disease symptoms start manifesting themselves in a deeper and deeper organ or the system. This is very important aspect of understanding. Now, we came to the important questions of how do we decide which organ or system is more important than the other. This was the question. The direction, which the disease will take, and conversely, the direction the cure should take in any particular individual. How do we judge whether after the removal of the symptoms, uh, the patient is on the right path or not? Okay, so these all are very important understanding that the question to be in our mind. So the most important of the organ and system can be known from the knowledge of embryology and physiology. So we have as far as learned that. So journey of disease can take place either as a result of unrestricted natural progression of the disease. Two things. The journey of disease takes place either natural unrestricted progression of the disease or due to suppressive means of any kind or a suppression. So there are questions in the mind that we have given this remedy. Do we suppress? So there must be two possibility. Either you suppress or either the natural progression of the disease from one to second layer. So this is what our understanding in this chapter. This can take place in a five way. Thus, suppression are of five types. So we have to understand what are the five type of suppression. First, location to location in the same organ. For example, vitiligo or eczema, spot on the lower limb getting better and appearing on the upper limb. So again, it is in the reverse directions of above downward phenomena at the same level. So this is a suppression, location to location suppression, the same location. Organ to organ in the same system. For example, nasopharynx to the larynx. It means pharyngitis to laryngitis to bronchitis. So many a time you came to the patient, sir, initially I do have a cold and cough and rhinitis and everything. So I took allopathic medicines or I took some homeopathic medicine for allergy, and now this was went away. But right now my throat is sore and pharyngitis has been. So this is the same layer, but from pharynx to larynx, larynx to bronchitis. Apathy on the tip of tongue disappear after remedy only to appear posteriorly on the fauces. Again, it is something that it has to be. See, we have understanding of the viral disease that the eruption start from the palate. That means on the palate, and then it comes out. So enanthema followed by exanthema. So whenever there is a external apathy on the tip of tongue and it went back, that means it is a sure sign that it is a organ to organ separations in the same system. Pain in the neck due to cervical spondylitis disappear to give rise to the hoarseness. It means again the inflammation of the cervical cartilage get transferred to the inflammation of the vocal cord. Again the cartilage remains the same, but it transfer from the one cartilage to the another cartilage. So again it is a separation. System to system suppression in the same layer. For example, bronchitis getting better and the patients develop a diarrhea or urinary tract infections. So again, this is a separation. So for that, sir has made a beautiful chart and go through that chart and you understand that it should be go in this way. Okay. System to system in a different layer. For example, GI complaint, endodermal disease like diarrhea getting better and patient develop hair fall or patient develop arthritis. So it is a mesodermal disease and further heart problem, endocrine getting affected. So this is what system to system in a different layer. The fifth point is miasmatic transfer. It means from one miasm to another miasm, from SORA to psychosis, a child suffering from tendency to recurrent bronchitis getting better, only to suffer from hypertension or getting tendency to develop lipomas. So this is what something that transfer from SORA to psychosis. The first three types of operations are self-explanatory. You know, organ to organ, location to location, and system to systems are self-explanatory. Last two are complex and important layer by layer separation. One can see in conjunction with the chart when the disease transfer or separation takes place from lesser important to the more important organ. Okay, so chart is helping you. From the knowledge of embryology, we understood that the ectoderm give rise to the tissue or organ which are lesser important, for example, skin, and when these are suppressed due to any reason, they travel upward to affect the tissue which have their origin in the endoderm, like the respiratory GIT, and furthermore to the mesoderm. If disease affecting the endoderm derived organs are suppressed, then they travel further inward upward as a chart to the affect the tissue which are derived from the third layer of embryonic disc means the mesoderm. But in this too, those derived from the mesenchyme, the connective tissue like a bone, cartilage, dermis are lesser important as compared to those derived from the mesothelium, parenchyma of the organ and viscera. We have to make it a correction. So this was the chart sir has proposed. I am sharing this chart in a group today. So you will have that guide. This layer-to-layer suppression does not occur easily, and hence the homeopath may get away with the wrong prescription like a mixture, compound, specific, or even partially similar drug till such time the immunity of the person is not severely compromised due to various reasons. So here immunity is compromised due to various reasons, matlab even though suppressions and natural development of disease because the person having a certain circumstances and which cannot cope up with that may lead to a deeper disease. This layer-to-layer suppression also forms the spectrum of degradations of the man from birth to the death. This concept can be simply explained in this way. The disease of the level 1 and 2, for example, skin eruptions, rash, boil, rhinitis, bronchitis, gastritis of the seconds, are frequently observed in the first few years of the man's life. So we have to understand that in the early life, a childhood, they develop the disease related to first and second layer. The third layer, the disease usually manifested in the teen or young age, for example, joint pain, psoriasis, hair fall, sleep disc, spondylitis, spondylolisthesis. Even in the medicine book, it was written that the psoriasis mostly occur after adolescence, so 16, 18 years, but you will find in a small child also. So that means that child is prone to psoriasis because the mother has passed some information to the child genetically. So genetical susceptible of that child is immunity is lowered and that lead to development of the psoriasis. Okay, so this is very important as well. The fourth layer disease are seen in the middle aged like the 30 to 50 years, but more often than not expression of the disease changes from simple inflammation to the indurations of the organ and the system or even to the destruction of the organ is a change in the expression of the disease. So this is something called as miasmatic shift from inflammation to induration and induration to the destruction. The type of the disease changes from spondylolisthesis to the atherosclerosis of the CVS producing hypertension and finally rheumatic arthritis changes to the gout. This is exactly what we mean called as miasmatic transfer or miasmatic suppression of the disease. So from initially psoric stage goes into psychosis or goes into syphilitic state. So miasmatic transfer or suppression. This is according to me the most important of the disease transfer. It is also the least understood. If the physician understands the base of miasmatic suppression or transfer, that the world of knowledge will unfold before them. Until now, we saw a certain type of excretion from one organ to another, say infections or inflammation being transferred from one organ to another. Eczematic dermatitis may be transferred to the rhinitis. Till the level of infection and inflammation is mild, the body tries to regain the normalcy of functions or homeostasis. This is SORA. So body is working diligently to maintain the homeostasis. SORA, the plain or benign inflammation, may or may not be because of infection arising out of deficiency on the part of organism deficiency in the normal functioning of the organism, and this deficiency or rather disease finding their origin in this deficiency are soric in nature. So we all know the sora is deficiency. So psychotic miasm. So psychotic miasm is represent as the representator is thickening, collection, hardening, induration, chronic greenish yellowish discharge, inflammations or inflammation giving rise to induration are all essentially psychotic in nature. This also include disease which are insidious in their onset and manifestations which remain hidden for long before they can be detected. For example, diabetes, hypertension from the atherosclerosis leading to cardiac ischemia are psychotic in nature. Syphilitic miasm, a destructions of the organ, perversion of the functions, lawlessness, and distortions are all expressions of this miasm. So ulceration or destruction which have distorted or ragged and jagged edges or even which cannot be delineated are syphilitic. So all psychotic conditions finally end up with the perverted functions or destructions of the different organ. It means they have a syphilitic end. Thus, we see how the journey of disease usually takes place in the human body, and from this we can also conclude that not only should the cure take place from above downward, inside outward, from more important organ to less important organ, from center to periphery, except in disease like the measles, chickenpox, and herpes, in reverse order of the appearance of the symptoms, but also from the more destructive miasm to the lesser destructive miasm. It means syphilis to psychosis to a sora. This corollary, which is my addition in the Herring's law of direction of the cure, according to me, should be given a lot of weightage in viewing any follow-up. So this is very important aspect of understanding. Whenever you are treating a case of dermatitis, a simple inflammatory dermatitis, you are prescribing certain medicine and patient develop cracks in that lesion or thickening in that lesion. That means the shifting of miasm from sora to psychosis, psychosis to syphilis. So very important, you have to reverse this process in the understanding of miasm. So if we are now compare with the chart given, we can see that the disease travel from the below upward, from the left side to the right side, from sora to psychosis to syphilis. Conclusively and logically, the cure should take place not only from the above downward as per the chart, but also from the right to left. This was a chart understanding. So I will share the chart with all of you. By this, I mean to say that only bridging the disease to a lower layer is not the sufficient. It should be brought down miasmatically from the structural changes to the functional changes. Very important. So knowledge of different type of transfer of the disease is essential to every homeopath, because only if he is aware of such thing, he shall be able to see it in his patient. In short, I do not see what mind does not perceive. So conclusions, the sequence occurring during the cure are the mathematical certainty. All homeopaths should leave their extremism, which lead to unsure and unpredictable result, and opt for totalistic homeopathy, by which results are sure, predictable, and mathematical certainty. This will be the first step toward the perfection of homeopathy. Dr. Prafull Vijayakar, Mumbai. So we have concluded this book today, and we tomorrow morning we will have a discussions on this. So we understood uh, up till now what we have understood from this, and what we have to take care whenever the patient comes to us, and what sort of things we have to keep in the mind whenever we are prescribing the remedy, and our remedy is right or wrong. So we have to judge these things by means of this. Okay, there is one question that if the eruption was first developed on the face and later on the lower extremity, then according to opposite direction of the girl. No, anything which happen at the level of the same layer, it has to be follow the law of above downward, apical dominance. Okay, cephalocaudal dominance. Okay, so it has to be removed from head to foot. Even though eruptions occur in the above downward is not the value, because we have to remove the process, and apical dominance is also governed by our genetic code, as we have seen in embryology. So this has to be removed. So this is, there is one corollary, reverse order is wrong here, but the importance is above downward. Okay. Before importance of above down and everything, the importance what sir has made, that is the miasmatic shift from the syphilis to psychosis and psychosis to sora is very important in each and every cases. So you cannot land up with the syphilitic trait. Okay. Any questions? Hope you all are waking, and I want to show you all on a video. So keep on your video. Is the story man can be cured with the sepia? What possible perception rubric we can take? I didn't get Dr. Daulatabad Yogita. I didn't get. Okay, lizard man. I don't know. I don't know. I know about the story. This is the story of a nocebo effect. So any belief system which negative impact on our immune system can create a disease. So just I am sharing that nocebo effect. I didn't analyze that case, and I didn't have prescribed that remedy. Can be possible. Possibility is there. Okay, we can think of, but this is not the what we called as we have to just look into air that by the storytelling we just prescribe. It is not like that. Okay, uh, I don't think of any perception related to that right now. But this is a nocebo effect. Okay. So any negative belief can, so we have to go into the depth of his life and then we have to conclude that what was the perception he had. Okay. Hope you got Dr. Yogida. Sir, FT after gastritis getting cured is also a bad sign. Absolutely. Okay. Any question? Say, I advise all of you read again, read this book. After reading three, four times, five times, you will get the answer of your questions from workbooks only. Okay, because this will guide you that sir is telling you something that you have to go deeper into understanding. Okay, so reread. That's why we have started the reading club. Okay, so by reading and understanding certain phenomena, we can just judging what we are doing right or wrong. So this is what we are right homeopathy teaches us. Yes, taking Ayurvedic medicine with our can lead to suppression. Yes, absolutely, doctor. Advise patient, uh, don't be a son of Sardar. Don't be a son of Sardar. You cannot drive two horses at a time. So patient, tell the patient. I generally advise the patient that don't be a son of Sardar. Don't drive two horses at a time. Horses never have problem. You have a problem, or you will fall. So this is what you have to advise the patient. Don't take, or either take Ayurvedic. Don't take homeopathy. Why should you come to us? Plainly, this is what you have to be very dare to be wise. Okay. Yes. Very important questions. Embryologically, both develop simultaneously, but the first and foremost is importance is air. One can survive. The importance respiratory is more important. Then it goes to the GIT. Then it goes to the eliminating process. So one importance given to the respiratory is more because respiratory is for survival. So from survival, one can survive cannot survive without the breathing, whereas one can survive without 2 days of food. Okay, so respiratory has given this point important. This was sir's understanding. I will get back to you with this answer because I need to understand in a deeper sense why sir has put everything because both are the same layer and there are certain point which was given by the sir that is you have to understand that why it was this corollary. Even heart and lymph node is given. So something is embryologically it is connected and it was given very important because the organ is anatomically organ is developed first and then its function started. Okay, so the anatomy also important and then physiology is important. So this is what very important question that a respiratory to GIT symptom shift is separation. This was first understanding and I need to look back into this. Okay, fine. Any questions? So tomorrow we will have just discussions on this question answer sessions. Read this book, and if you have any questions and query regarding the theory of separations, and so we will have a discussion tomorrow. Day after tomorrow, we will start with the another book reading. Okay. Hope you enjoy this series of morning learnings. Your inputs are valuable to me, so you can directly message me or you can have feedback on this. So we will make our learnings and reading club for a better betterment of all of you. Thank you. So you all are requested to share your feedbacks directly to me on my number, or you can share in the group also. Thank you. Thank you so much. So we conclude our meeting today. Thank you. Thank you. Thank you.